Welcome to my channel. Today's discussion is for doctors and medical students, and today's topic is exercise-induced asthma. So what is this exercise-induced asthma? If you do a vigorous exercise for some time, say 6 to 8 minutes, then after stopping exercise, a few minutes later, maybe 10 minutes later, you will feel sort of tightness of the chest and sometimes a little heavy breathing and occasionally coughing also. This is exercise-induced asthma. Diagnosed asthma patients, when they take exercise, they will definitely get breathless. But here what we are discussing is somebody who is not having asthma at all, when they do exercise, heavy exercise for a few minutes, after stopping exercise, they become a little breathless. Asthmatics are known to have breathlessness following various triggers. But in exercise-induced asthma, they have, suppose they are not asthmatic, then they have a bronchospasm only in response to exercise. So some people tend to call it exercise-induced bronchospasm rather than exercise-induced asthma. Exercise-induced asthma is more pronounced when you are doing exercise in cold air and dry air. So what are the things that we understood about exercise-induced asthma? It comes following vigorous exercise for a few minutes. It is more pronounced when you do exercise in cold air or dry air. It goes off on its own. Whether you do something or not, in about 30-45 minutes, it just goes off. And the most important thing is the breathlessness occurs not during exercise, but after exercise, a few minutes after exercise. That is the most important point. Let's see how all these things happen. The normal airways are lined by mediator-bearing cells, that is, cells that are containing ready-made mediators ready to be released in case of necessity. In case of exercise-induced asthma, this is a little bit more sensitive. They become breathless, or the mediator-bearing cells degranulate much more readily as compared to normal people. Now we mentioned three triggers. One is vigorous exercise, the other one is exercise in cold air, another one is exercise in dry air. We shall analyze each one by one. Suppose we are doing a vigorous exercise. What are we doing? We are breathing heavily. So a column of air moves up and down very fast. This possibly is physically abrading the mediator-bearing cells lining the mucous membrane, and it is physically degranulating it or bursting the cells to release the mediators, and this causes bronchospasm. But then during exercise you don't have this breath problem. So why after exercise? Because during exercise you have adrenaline secreted, because adrenaline we all know is the fight, flight, fright, that sort of hormone. So that is secreted, so it dilates bronchus in spite of having your mediators getting released. But after exercise the adrenaline secretion stops, and adrenaline we all know has got a very short half-life. So after some time the mediators get an upper hand and the bronchoconstriction ensues, because the mediators have got a longer half-life as compared to adrenaline. I said in normal also this normal people also this mediator-bearing cells are there in the mucous membrane of the airways. So can normal people have a bronchoconstriction? At least some people do have, but it is never more than 10%. When it is more than 10%, that is 12%, 15% or more, then you call it exercise-induced asthma. Otherwise, we term it as a normal variation only. Exercise-induced asthma people may have more mediators or more readily degranulatable mediator, or more sensitive to stimuli to degranulate, or a combination of these things. Now in real life, what are the evidences that heavy breathing will cause bronchospasm? Suppose you run. After running you may get bronchospasm, but after walking you don't. So vigorous exercise is the trigger. That is one. Another example that is experimentally proved is you do voluntary hyperventilation for 5 minutes or more, and then after a few minutes you start feeling breathless. So that is another evidence that vigorous air column movement causes bronchospasm. Now coming to dry air. Normally the air, when it is going through the nose, nasal passages and upper airways, it gets humidified, so that when it reaches down the lower airways, it is already humidified. But suppose it is dry air, then by the time it reaches the lower airways, it's still not adequately humidified. So it draws fluid from the mucous membrane or mucous fluid layer, so that mucous fluid layer becomes hyperosmolar. This osmotic drag may be the factor that is causing degranulation of mediator-bearing cells. What are the real life evidences on this? One is swimming causes much less likelihood of exercise-induced asthma. And suppose you are running with nose breathing as compared to running with mouth breathing. Mouth breathing will cause more bronchospasm, because when you are breathing through the nose, there are turbinates, there is hair, so there is a lot of air turbulence there. So much so, by the time it reaches the lower airways, it is all well hydrated, well humidified. But when you are breathing through open mouth, it's a large column of breath. So only the peripheral region of the breath column, the air column, gets humidified. So when it reaches the lower airways, there will be air that is still yet to be humidified. So it draws fluid from the fluid layer of the airways and causes osmotic drag to produce degranulation. Now what about cold air? Vagus can definitely produce bronchospasm. So cold air can stimulate vagus to produce bronchospasm, but the vagus innervation is there only in the first proximal 6 or 7 branches of airways only, not in the lower airways. So it can only partially explain, the vagus mediated bronchospasm can only partially explain the bronchospasm following cold air exercise. In real life, it is exemplified by the fact that ipratropium bromide, if it is taken before exercise, it only partially protects the exercise-induced asthma. So what is the additional factor that is causing exercise-induced asthma in cold air? When the cold air is going in, because it is cold, it causes vasoconstriction, and then when it is coming out, it is already warmed up, so it causes vasodilatation. So periodic or cyclic vasoconstriction, vasodilatation, this will cause destabilization of mediator-bearing cell, and that could be the reason why it is degranulating and cause bronchospasm. And the common proof of it is when you do outdoor running in a cold morning, you will get exercise-induced asthma. But the same intensity exercise, if you do inside the room, for example, using an exercycle, you are less likely, actually far less likely to develop bronchoconstriction. So that is a real life evidence of cold air causing bronchoconstriction. Now how can we prevent exercise-induced asthma? You can take 2 puffs of salbutamol some 10 minutes before exercise. That will protect you against exercise-induced bronchospasm. How does it do it? In nature also does the same thing. No? During exercise, there is adrenaline, so there is no exercise-induced asthma in spite of mediators being there. But in nature, this adrenaline has got a short half-life, so after some time you become breathless, and that is what the exercise-induced asthma is all about. The advantage of salbutamol is it has got a longer half-life, 2 or 4 hours. So actually it outlives the mediators also. So even the mediators, their effect is also gone in about 30 minutes or 45 minutes. So you are totally protected against exercise-induced asthma if you are using salbutamol. Now in asthma, we know once there is a trigger and the inflammation produced by the trigger, then there will be a late phase reaction 6 to 8 hours later. So can the same thing happen with exercise-induced asthma? One, it is much less likely. Why? Because this trigger is a one-time event. The moment you stop exercise, the trigger is gone. So there is no continued inflammation. Suppose there is an inflammation initially and it draws some inflammatory cell to the site, there can be a late phase reaction in some cases, but there is no continued trigger. So even if late reaction comes, one dose of salbutamol inhalation will take care of it. You do not require steroid. Why? Because steroid is required to contain an ongoing inflammation, and ongoing inflammation is not happening in exercise-induced asthma. Can you manage exercise-induced asthma non-pharmacologically without drugs? Theoretically possible if you can do short bursts of heavy intensity exercises as warm-up. Then it will degranulate almost all the mediator bearing cells, and then to recoup mediators it takes some time, maybe 2 hours or 3 hours. So after this warm-up, for next 2 or 3 hours you are free from exercise-induced asthma even if you do exercise. So that is possible, but that is not very much feasible, because this warm-up exercise should be strenuous enough to degranulate almost all the mediator bearing cells, which is possible only for an athlete, not really for a common man. Parents of children often ask why do exercise, invite trouble and then start treating and preventing. Actually, exercise has got so many benefits. Very good vital capacity, very physical well-being, mental well-being, then musculoskeletal benefits, cardiovascular benefits. So the benefits of exercise far outweigh the difficulties or inconvenience of exercise-induced asthma. So it should be positively encouraged. In fact, salbutamol is allowed even in competitive sports because it is not a performance enhancing drug. So the summary would be, we must positively encourage exercise in people having exercise-induced asthma. Then exercise should be undertaken under cover of beta-2 agonist, preferably by inhalation. And if it is possible, avoid cold air and dry air. See, for example, avoid open air running in a cold morning. Then swimming is the most suitable exercise for somebody having exercise-induced asthma. And between running and a game is a little better, because game is you have short burst of activity, then you are sort of relaxed for a few seconds, then short burst again, that way. So it is like the non-pharmacological intervention that I mentioned before. You by short burst, you degranulate your mediator bearing cells, so after some time you don't feel like breathless or chest tightness. So these are the some of the tips as to how to encourage exercise in a child or an adult with exercise-induced asthma. Thank you.